Hello, everybody. Welcome to Q&A with
Oh, my hair is a mess.
with A&V.
Oh my God.
I'm Vincent Racaniello, and who do you think that is with the hair? That's Amy Rosenfeld. I'm in New Jersey. She's at Columbia University in New York, and it is great to see you all again. We are doing this every week, 8 p.m. Wednesday, and we love all of you. And there's a ton of questions already accumulated. But before we get to them, there has been someone here the past 2 weeks who wanted to ask Amy, why is it that rhinovirus infections went up some time ago? Because if you look at the BioFire site. So, Amy, what do you think?
Well, first of all, is the hair better? I mean, it was sticking up like a rooster before. I think it's
The hair
better.
is fine. People are saying your hair is fine. No
It was
worries.
sticking up like a rooster. You can't have rooster hair. That
No
looks
worries.
ridiculous.
How about rhinoviruses?
So the rhinoviruses. So rhinos are picornas. They're in the enterovirus family, which is the most ubiquitous human pathogen. There are more than 160 isolates of rhinovirus. And by definition, just that prevalence, you're going to see way more rhinoviruses. And they're going to be the first viruses to come out and peak and be detectable because there's so many different variants or so many different serotypes of them. And so you can find them easily. And some are more seasonal than others are. So, or less seasonal.
So why do we have a big peak?
It's mostly because there's so many of them, and the probability of you being infected with them is higher.
But they were circulating even though we were masking and distancing, but I guess we weren't enough, right?
Right. And so was EV68. EV68 was circulating even though we were masking and distancing because it's not 100%. And so, like, we had thousands of cases of rhinovirus, but we had like 38 cases of EV68 because theoretically there's only one serotype and there's less abundant.
Okay. Hopefully the lady who asked you that is here. If not, you would have missed it again.
I'm sure she'll be around.
Can you tell us how to reach your Reddit AMA? So the one I did was on the coronavirus subreddit, and I think so they want me to do one more regularly, and I'm not sure where it's going to be, so I'll let you know. It won't be till next week, so somehow I'll get it out there. Do we have any data on if natural infection or vaccine ends up being better? No, it's too soon. It's not. We don't have enough time, right? We need longer term studies. It'll be done, right, Amy? Don't you think?
I don't know. I don't even know what ends up being better means.
Yeah.
So I'm not clear. But no, I think like when we hit herd immunity and cases really like low level, they plateau and it becomes a more common part of the more common coronavirus category. I'm not sure that we will have moved away and not finished all of those studies.
So someone said rhinoviruses are extremely adapted to humans, right?
Yes, they are. But actually, you can get wild type monkey or ape gorilla infection. So years ago, Palmenberg and her collaborators showed that Rhino C can infect chimpanzees and kill them because they don't have the alteration that we have that prevents virus that reduces efficiency of virus binding. And it's not just that so Peter Ginsburg writes that rhinoviruses can be asymptomatic and transmitted, but flu can be asymptomatic and transmitted. So it has to do with the number of different types of rhinoviruses. They're much more plentiful than flu and stuff. Just have to do the math.
So someone later on says, I thought the vaccine is better protection against variants than natural infection. No, it really hasn't been studied. They haven't been compared. I mean, the point is that the vaccines do well to induce T cells, and that protects you against serious disease with the variants. But we don't know how it compares to natural infection.
Well, I also think what is your gauge for saying it's better? Like the
Right.
durability of immunity, the number of epitopes that you have, the initial burst of antibody production. I'm not clear the amount of memory B cells or T cells that you produce from it. I'm not really clear what there's a lot of things that go into it. So I'm not really clear how to, what it's talking about.
So John Snyder points out there's a preprint on differences of vaccine versus natural infection. Yeah, we're going to see a lot of those. They may measure antibodies, they may measure T cells, but what it means is not going to be clear for some time, I think.
Well, not only that, but when are you measuring it?
Yeah.
Are you measuring it 2 weeks after vaccination? Are you measuring it 2 months after somebody resolves infection?
Mm-hmm.
When are you measuring it?
No, that's a good question.
Are you measuring it 9 months later?
Yeah. Well,
and what are you measuring?
There'll be lots of studies.
Well, maybe not.
Could you please explain the importance of vitamin D for immunity from perspective of viral infections such as SARS-CoV-2? I don't think anyone could explain what it is that vitamin D is doing for any viral infection. It's thought to be an immune system booster, but exactly what that means, I don't know. So the thing is, if you're in a place where there's not much sun, you probably need some vitamin D, so take it. There was a study that Daniel talked about a few months ago where they gave sick patients a whole lot of vitamin D, and it really didn't help them. So I don't think you can wait till you're really sick to take it. If you take it constantly ahead of time. Amy, do you take vitamin D?
Yes, because I am allergic to milk.
I didn't know that.
I don't see enough sun.
I didn't know you took vitamin D.
I do. I'm not good at it. I keep forgetting.
So sometimes
I
you miss.
take it like 3 days in a row, then I forget. Then I take it for like another 10 days in a row. Then I forget for like a couple of weeks. Then I see the bottle and I take it some more. Look, I'm just not good at these things.
Does COVID stay in your body dormant like chickenpox with potential later reactivation?
No.
No, not that we are aware of. But if you ask this question of Ebola before 2015, you would also say no. And then it turns out it can persist in some immunoprivileged sites like the eyeball and the testes. So we could be surprised, but I doubt it.
I would doubt it, and I would think people have already looked, and they have probably looked for in mice and are not reporting it. So I'm not thinking yes.
So Leo says, we did mold on cheese last week. How about mold on bread? No, I'm nix on the mold on bread. I throw the whole thing out. I don't cut it off like on the cheese.
Why would you have moldy bread?
If you keep it around a long time, you can get mold.
No moldy bread.
In a previous TWIV, ACE2 inhibitors and temperase blockers used in conjunction was suggested as being efficacious. Not ACE2. We were talking about cathepsin inhibitors, or hydroxychloroquine, which prevents endosome acidification, would basically inhibit cathepsin proteases. So there are two entry pathways.
So you're blocking both entry pathways?
Yeah, if you block both, you block both entry pathways. But the hydroxychloroquine Tempress trial was canceled. So we don't know. I think it would be efficacious to block both, but I don't know. We're going to find out.
I don't know.
My district in Ontario just identified our first variant of B1617. What do you know? It has a few spike changes, and it's, I don't know what fraction it is in your place. You could go to covariance.org and see. In most places, these are a small fraction, with a few exceptions. But I don't think people have studied this in terms of, do antibodies not block it well and so forth. But the problem is that the T cells can probably handle it.
Well, that's not the problem. That's the benefit, right? That's a good thing.
Yes, it's not a problem. Yes, I made the wrong word, Amy.
It's okay.
I made the wrong word. So, Amy, Oscar says, would I take Sputnik despite the latest news? What's the latest news?
So the latest news is that Brazil canceled their contract to get Sputnik because they believe they add 5 vector is replication competent.
How could they make such a mistake?
Because they didn't call us.
Yeah, I wouldn't take it if they found something out that was not supposed to be there. That's not a good idea. Nope. There will be enough first doses for every Canadian by July 1. September fully vaccinated. That's great. Yeah, I heard someone say...
I'm not sure about that. That's not what my friends are saying in Montreal.
Oh, yeah?
So, like, my friend who is pregnant, her significant other
Yes.
is unable to get vaccinated. Mm-hmm. And she is only getting vaccinated on Saturday because she is pregnant. And then she is not getting her second booster for 4 months. And so this is April. So that is, I'm not even sure she will be able to get at 4 months because she is due on August 9th. And that would be like 4 months, a little later than 4 months. But it would be good if she did, because then she would pass the antibodies by breastfeeding to her baby. But I'm not sure. But it's unclear when her significant other, who's also in his mid-30s, would be vaccinated. So I'm not sure.
My 7-year-old obese friend is concerned she may be one of the small percentage for whom the vaccine does not work. Can she find out with a test?
Not that I'm aware of.
We get an antibody test, no, Amy?
Well, that's after she gets the vaccine, right? I'm not aware of a test that would tell her if it's worth getting if the vaccine will work or not.
Oh, you mean protect her?
Oh, yeah.
No, I agree. But you could find out if you have antibodies.
Forehead, right. But I thought she meant beforehand, before she got in line to get vaccinated.
Oh, no, yeah, you're right. If it's before, no, there's no way. You just have to get it, and then you could take an antibody test.
Right.
Yeah, Amy's right. Amy's very clear with the reading of the question. Vinny is a little less clear.
It's okay.
Why are Washington and Oregon having COVID issues? Is it something from Canada? No, I don't think so. It's pockets of people who are unvaccinated and they think it's over, and they're, going out there and interacting.
Yeah, we had the same problem here in New York and New Jersey. Your state was a disaster.
My state?
Yeah, your state, not so good.
Here, it seems like B1429 is overtaking B1117. These variants just emerge. They have a race with each other, see who's most fit. And it doesn't really matter. Someone later on in the chat said in Brazil, they've decided the variants didn't make any difference in the outbreak. Amy.
That's true. You know what? I read that paper.
I would say shocking, Amy.
I know.
So Amy sends me papers.
Sad.
Amy texts me.
Shocking.
Amy texts me papers, and then, it's an obvious result, and she'll write shocking.
Yeah, earth-shattering. I could never figure this out by logic. It's kind of like my last TWIV, right?
Yep. How easy to confirm or disprove the rumor that Sputnik has replicating vectors? Very easy. You just throw it on cells and you can measure DNA replication by PCR. That's the measure of replication. You need a lab, of course. You can't do it in your garage. We just got down to the start. Do the mRNA vaccines make any cell-produced antigens or only dendritic cells? Go ahead, Amy. Take it.
So the mRNA vaccine gets uptaken by any cell, and then it will translate the mRNA and produce spike, and then it will present it on the surface of the cell.
Yeah.
So any cell in your deltoid can make antigens that uptakes the lipid particle. And since the lipid particle is just cell membrane and there's no real difference between the lipid composition between dendritic cells and the muscle, yeah, sure.
According to Fauci, Covaxin can neutralize the Indian variants. That's right. But
yeah,
I'm not sure neutralize is so important. Go ahead.
I'm not really clear why this is surprising.
No, it's not surprising. Well, neutralization. Okay. Neutralization is the key.
Covaxin induces antibodies that neutralize the variants that are circulating around in India. Shocking.
Yep. There you go. There you go with the shocking. Leo thinks your hair color is great.
Wasn't my hair color. It was standing up.
Tom yes, said,
the
you're
hair
fine.
Color is good. The Amy's, hair color is good.
Andrew says, hair today, gone tomorrow.
No, I will never be bald.
Yes, horses have a coronavirus.
Yes, it's called equine.
Equine coronavirus, ECOV. Can they be infected with SARS-CoV-2? Do you know the answer to that, Amy?
Not to my knowledge. I don't believe that ACE2 of equine is similar enough to be susceptible, because they are running the Derby this weekend, and they would not be running the Derby if there was a potential chance that the horses would develop disease, because those horses are a lot of money. Especially the one that wins, when you stud it, it's worth a ton of money.
There's a mouse
there is
in your
no
hair.
Mouse in my hair.
Amy and I worked on mice today.
Yes, we did. We're not so successful today.
Oh, we were pretty good. What retrovirus infects the most amount of people? HIV. Well, infects HIV-1. But we all have endogenous retroviruses in our genome, all different kinds. That we got many years ago.
Mm-hmm.
Should monoclonals be referred to as passive? Yes, but it has nothing to do that they don't have a T cell component. Passive is when you give someone products of the immune response. Active is when you give someone an antigen and have them make the response. That's why it's active.
Right.
Please discuss what it will take for Moderna and Pfizer to get actually approved. As opposed to EUA.
Study.
Yeah, they have a 2-year phase 3. And when that's done, they'll submit to the FDA, presumably. Thank you, James, for your super chat. Amy Admirer in Topeka, Kansas. Wow.
Wow.
James, you have an admirer in
Lovely.
Kansas. Amy,
okay,
I don't think we're in Kansas anymore.
No, I was never in Kansas. Actually, that's not true. I drove through Kansas. I went from one end of the state to the other end of the state on this highway. I think it was like 85 or something or other. And you know what? When I entered the state, it said McDonald's 3 miles away. And when I was leaving the state, it still said McDonald's 3 miles away. It was like hysterical. 5 hours later.
What do you think about the vaccine patent waiver issue that's been suggested by the White House?
I think it's good.
Really? You think it would speed up production?
I would hope so.
I mean, get more companies involved, but...
Yeah, I think... And it also makes it more affordable to lower income countries. They don't have to, they can't pay, you know. When you are a generic drug, you're like 10% of the name brand drug.
Yeah. New
I think,
studies in sorry, go ahead. Go ahead.
no, that's okay. Go ahead.
New studies in Brazil are starting to show variants did nothing to the spread. People need to be accounted for reckless behavior. Yes, I think we've said this for a long time on Twiv and here on Q&A with A&V.
Yes, but that's the wrong answer.
What?
To
What's the wrong answer?
To say that people need to be accountable for their behavior. So it looked, oh yeah, there it goes.
Thank you, DR, for your super chat. Is it conceivable that on the back of all the focus on immune responses in this pandemic, we will gain insights that will push research into autoimmune diseases, MS, several years ahead of schedule? One would hope, but Amy and I do not have a lot of confidence that once this is over, we'll be back to back to the way it was before. So it would.
It should, but I'm not sure that people will make the analogies appropriately and then try and link the findings. People seem not to be able to put together multiple pieces all at once. It seems that they look at it in a very myopic fashion. They don't know how to apply the knowledge to a question that may not be so intuitively apparently intertwined, but they are.
Jennifer, thank you for your super chat. This definitely does not cover all the sanity you have returned to me over the past year, but it's a start. Thank you so much. We appreciate it.
It's lovely.
Hello from Kosovo. I've heard Amy say CoronaVac is a crappy vaccine. Why? 100% protection from hospitalization. Aren't T lymphocytes important? By the way, we are vaccinating with CoronaVac in Albania and AstraZeneca.
I said,
did you say it was crap, Amy?
Maybe I said it was crappy because it's like 50%, right?
I don't know if that's the one that's 50%. We got a great email today that sorts out all the 67% in Chile effective against symptoms, reduced hospitalizations by 85%, intensive care 89%, deaths by 80%. In Brazil, it was 50% at preventing symptomatic infections, 83% effective in preventing mild cases. So it's not so bad, Amy.
It's not so bad. It doesn't sound... I'm not sure that I really said that it was crappy, but if I did, I was wrong.
Is your university requiring students and staff to show proof of vaccination as the UC schools will do so in the fall? Yes,
I don't
right,
believe
Amy?
that Columbia, they are requiring you be vaccinated. I don't believe Columbia has decided whether or not you need to show proof.
They're going to take your word?
They haven't made the decision yet. They just said that they in order to come back, you have in September, you have to be vaccinated. They have not gone the extra yard to say how you have to demonstrate vaccination.
Yeah, that's the important part, right?
Yes, but there's no reason to focus on the details now in May for something in September, when they have umpteen million months and they can wait until August 31st to make their decision.
Can you explain how Pfizer's experimental SARS-CoV-2 protease inhibitor works? Did you hear about this, Amy? It's in phase 1.
No, I did not hear about this.
It's a protease 3CL inhibitor. You're familiar with that protease, right?
Yes, I am.
And it's an orally available inhibitor. And so it is probably a mimic of the active site. It's probably a peptidomimetic. It mimics the peptide that fits in the active site and blocks the natural substrate from getting in. Phase 1.
Okay.
Maybe it's early. Is the adjuvant of unsaturated lipid nanoparticles synthetic?
I did not know that there was an adjuvant in the Pfizer and Moderna vaccines.
I think the lipids act as an adjuvant to some extent.
Can
Would
it be?
I don't know. Do you know, Amy?
No, I don't know. But where's the peroxidate? Where's the peroxidase in the cell membrane? Peroxidases are really toxic. So you have a little organelle, like the peroxisome, that Jillian Small. You should know, or Dara should know who Jillian Small is.
She used to work on
She's
that.
Yeah, peroxisomes. So I don't know where the peroxidase would be in the cell membrane because it's such a toxic enzyme that it lives in its own little vesicle.
Amy, when the nanoparticle is taken up by a cell, it's endocytosed, I presume, right?
I'm not sure. I thought it fused directly with the cell membrane because it was of very similar lipid composition. And how would it? I mean, I guess it could be endocytosed in a non-specific fashion, but not receptor mediated.
Yeah. Okay. But at some point, the RNA's got to get into the cytoplasm, right?
Yeah, but if you fuse at the cell membrane, you're expelling it. And even if you're non-specifically endocytosed, you then go to you're still fused to the late endosome and released. But I would think you wouldn't want to do that because RNA is really sensitive and the late endosome is highly acidic. So I wouldn't think you would want to do that.
Adam says, I would guess that almost all viruses can be asymptomatic and transmissible.
No, not all viruses can be asymptomatic and transmissible. Measles and smallpox are completely 100% asymptomatic. What measles person do you? Yeah, what measles person do you know never had the rash?
Yeah, so rabies is another one that's almost 100%. Yeah, so not all, but many, for sure, many.
It also depends on what you consider asymptomatic.
Well, you don't feel anything. You don't feel fever.
Yeah, but like polio, you get a febrile illness, and most people just ignore it and would say, I was not sick from polio, but in actuality, you actually did have a mild fever.
Yeah.
So I'm not clear.
Someone says the lipid acts like an adjuvant somehow, but we don't know how. Okay. A long hauler question: can my vaccine antibodies turn into super autoantibodies following a recent infection between vaccines? Well, that's quite a combination of events there, Overjoyed. I don't think so, but what do you think, Amy?
I don't know, but I'm sure Daniel has talked about this because this actually is the opposite of what Daniel and the clinicians are reporting, where you get vaccinated and your vaccine, if you're a long hauler, reduces symptoms, right?
Yeah. Yep. Here's a commuting question. If fully mRNA vaxxed, would you feel comfortable riding transit buses 45 minutes masked, close proximity? Yeah, I would be okay.
Well, sometimes we end up doing that on the subway, right? When we go see spaces.
Right? So, Amy and I still wear our masks outside. We go to the Mouse House, we wear our masks, even though we don't have to.
Yes. And sometimes we're on the subway for more than 45 minmes.
Yeah, and like tomorrow morning we will be, right?
Yeah, and sometimes it's crowded. And sometimes I've been on the subway coming home from Lower Manhattan and it's fully packed. Like, oh my God, it's before the pandemic, standing room only.
Yeah.
And for me to go from South Ferry all the way up is more than an hour.
Marty, thank you for your super chat. Wednesday, 8 p.m., my highlight each week. Thanks, A&V. Oh, thank you so much. That's very cute. Highlight each week.
That's very nice. It's lovely.
How are vaccines performing in India? Do you have any information about that, Amy?
I think the problem is there is no vaccines in India. I think less than 1% of their population is vaccinated.
Yeah, it's a real tragedy. The latest anti-vax canard is that mRNA vaccines are gene therapy. My first instinct is to say, well, so what if they were, but doesn't gene therapy require that genetic material be changed? Do you know the answer to that, Amy?
I don't believe that it requires the genetic material to be changed. I believe it just requires that the phenotype be reversed, right? Because I don't think that when you do adenovirus, what do they use? What do they use for like sickle cell anemia? I don't think that actually corrects the genome. I think it just makes the normal hemoglobin exogenously. You know what I'm saying?
Yeah. Well, I mean,
I don't think
either
it
way.
goes and replaces. I don't think it goes and replaces the mutant hemoglobin gene. I think the gene is then exochromosomally producing the RNA that then makes the normal protein, and it's considered gene therapy for sickle cell anemia.
But certainly mRNA vaccines are not gene therapy, right? They're vaccines.
Well, right, but I don't know. Yeah.
Bad Cat, thank you for your super chat. Why no vaccine for Lyme disease? I've had it twice and many don't get diagnosed. There used to be one and they took it off the market.
Not effective.
It was not very good. Effective. Yeah. And whether they're working on others, I do not know.
We're not bacteriologists.
Thank you, Plinky, for your super chat. Thank you for sharing your brilliance and insights, A&V. Since vaccinated can be infected, will this aid in herd immunity as they go without masks? I'm not sure they will effectively transmit it to others. So if that's what you're asking, do you think that's what he's asking, Amy?
I'm not sure. I'm not sure what he was asking. I mean, you're not counting yourself twice as part of being immunized. And if you're not so I don't understand how, even if I don't understand how you're increasing or you're altering the percentage needed to get to herd immunity. It's not really clear to me.
Can the PCR tests for COVID miss the new variants?
I believe that they've been revised and are very specific now for various variants.
So Andrew says in India, 1.7% of the population is fully vaccinated. 8.79% has one dose. Thank you.
Okay, Andrew. I was close. I said about 1%. Maybe, I was kind of close. But if you're a gazillion people, 1% is not that much.
No, of course not. Hi, Lost Laboratory. Any news on studies of the mRNA vaccine immune response in people on immune suppressing drugs like mTOR inhibitors and drugs used for arthritis? Any insights, Amy?
No, but I'm not sure that taking an mTOR. So technically an mTOR inhibitor should reduce translation, but it doesn't. It's very specific for what transcripts are targeted for translational control via dephosphorylation of BP. So if you have a very short 5' untranslated region that's very unstructured, whether or not you reduce the amount of 4E, that's free to, initiate translation really has no effect. And I highly doubt that they put like a 5' top sequence on it. So I'm assuming that it's like a very short 5' unstructured Kozak sequence. And so it would be resistant to mTOR inhibitors anyway.
as humanity moves past this, does it mean that COVID future variants will be less deadly since we now have been exposed to this like other viruses over the years? Now, Amy always has an idea about this, right, Amy?
I guess. So less deadly in terms of what? So there's just so many old people you can kill all at once, right? They don't replenish that frequently. And so you're going to be you're going to have a very significant older population that's immune, and we're saying that children don't, very few children are dying from SARS-CoV-2. So it would appear that yes, maybe theoretically it would be less deadly.
It's a good question. We'll follow it. Stay tuned. Christina thinks you're simultaneously hilarious and adorable.
It's good.
Thank you, Post Polio News, for your super chat. One more light bulb for the studio. For those of you that know, right below the chat, there's a little $sign. You could give us whatever you want. We're opening a new recording studio sometime in the next few months. Love to have your support. And Amy has been doing a lot of the legwork. Okay, this is from D614G. Oh, you changed your handle.
It's good.
If a myocyte,
it
was reversed before. If a myocyte is transfected by vaccine, how long is it likely to survive before being identified as infected and killed in a person who has not had previous exposure? Oh, so how long will it take for the T cell to recognize that infected cell? It could take days, because these T cells are supposed to be circulating. But remember, there are lots of different specificities, so it's a matter of them encountering it. So I would say days. What do you think, Amy?
Could be. I mean, I don't know that I would use the word infected, because it's not virus.
Yes, not virus. So if you were previously exposed, then you should have a memory response, which would be even faster, presumably. But what can you tell us about Novavax developed on Shingrix? So Shingrix was the glycoprotein of varicella zoster virus produced in insect cells using baculovirus vectors. Insect cells in the lab, you put the gene in, and it's the same thing with Novavax. They put the spike gene of SARS-CoV-2 in a baculovirus. They infect insect cells, and you can make a lot of protein. Similar technologies being used to produce influenza HA in insect cells. And,
yes, but what's interesting is that you had Matt Friedman on Twiv like months ago.
Yeah.
And now we're entering May. What?
I know. It's late, right? I don't know what's going on. I've heard nothing. Where's the vaccine for Eastern equine encephalitis? I don't know. Not many cases. I'm not sure that it's a big priority. Sean, thank you for your super chat. You are amazing. Kathy, thank you. She writes, thanks, A&V. It's a joy to listen to you both, and thanks for all the education you've given me over the past year. Stay tuned. Don't go away. Come back now and then. I know that it's less pressing. COVID antivirals.
It's very pressing. You can never tell when there's going to be a childhood paralysis outbreak. You have to stay tuned.
March 716, thank you for your super sticker. Frank, any news on COVID antivirals? So we just mentioned there's phase 1. Pfizer started the phase 1 of a protease inhibitor. And so that's early. It's going to be a while.
I also think I saw one that talks about using some Hep C drug.
Repurposed.
Yeah, I put it in the folder.
Westfield 90, thank you for your super chat. Reserving my spot early as a visitor to the studio. Absolutely. I'd love to have people visit. Right, Amy?
Yeah, it's good. You should have people visit. I'm not visiting. I'm staying in the lab.
Amy's working. I think this is funny. Carl said, I want to know the genius who invented toast. They took some bread and said, let's cook it again.
It is. But you do have to admit, toast, a little butter, and some like raspberry jam is very yummy. Raspberry preserves, very yummy. It's very French. It's what I used to eat for breakfast in Montreal. What could go bad?
Would it not make sense for the virus to get better at interferon suppression since it carries many genes for this function? You have any thoughts about that, Amy?
Well, I think the virus is pretty good at suppressing interferon. Actually, I think Susan has addressed this. I think she's pretty convinced that these viruses are pretty efficient at suppressing interferon. It's just not all about the interferon, though, right?
Yeah, and you can't be too efficient because then your host will not transmit, right? He'll die. So it's a balance always.
Yeah, but Susan's work says that they're very efficient.
Amy, you can probably catch up on missed vitamin D because it's stored a long time.
Yeah, I don't think you should have that much vitamin D stored in your fat. I think it's toxic.
Pfizer second dose kicking my butt. How long did the side effects last? For me, the second dose, I had 8 hours of fever. It wasn't bad. How about you, Amy?
The second dose was a little inconvenient for a couple of days, like 5 days.
Thank you, Damon, for your super chat. And thank you, John Snyder, for your super chat. He writes, blueberry jelly on toast.
It's cute.
Yeah.
The thing is I don't really like jellies and jams. I preserve preserves because they have the actual fruit in them. You know what I mean?
18 days since I was vaccinated with J&J. Am I almost in the clear? Is he almost in the
clear? He's out of the... Yeah. It's 14 days. Plus, he's a male.
I don't know who Dr. Eric Feigelding is. Sorry. What do you think of Joe Rogan's advice for healthy 20-year-old? So he's not a doctor, right? And that you're doing that facetiously. Yeah, that I think he doesn't know what he's talking about.
I think he's a little... Go ahead.
It's a guy with millions of listeners, and he doesn't know what he's talking about. This is how it goes. And we have 472 listeners now, which is great. And they should be listening here, right? What were you going to say?
Yeah,
Amy?
but actually, I think it's actually dangerous what he's saying, because he's not. So if your child develops one of these long COVID problems or multi-system, whatever it's called, the MICE thing, whatever, the
multi-system inflammatory syndrome. Yeah.
Yeah. Is he going to take responsibility for advocating that he told people who were healthy 21-year-olds not to get vaccinated?
Oh, no, he won't. He will not take responsibility.
So I think actually he's very dangerous because he's giving you a false sense of security.
Yep. Totally agree. Roe wants to know, is it possible to get vaccine-caused breakthrough infections as suggested by the Israel study?
It's always possible to get breakthrough infections. They're only 97% efficacy, which means 3% of the vaccine people didn't respond and most likely or can get infected.
Yeah, there have always been breakthrough infections. We just never focus so much because now we're in a pandemic with so many people infected, so it's a big deal. But there have always been characteristic of vaccinations. They're not 100%. And, the Israel study is done just a few months after the vaccine, and it's kind of artificial because the immunity levels are too high. Well, look at all these super chats rolling in, Amy.
That's
we got
great,
John.
But
what?
It's not just this vaccine that you have breakthroughs. You
have
breakthroughs through polio. You have breakthroughs through smallpox, through, blah, blah, blah.
Well, we know from a study, it's already 8:45. We know from the CDC study that, of many millions of people in the U.S., there have been a few thousand breakthroughs, but most of them are mild. One more question, and Kathy's going to go.
Amy.
Why would the CDC director not see the value in having a PCR test that identifies variants at the same time calling it whack-a-mole? Is that what she called it?
I don't know.
Well, if she said it was whack-a-mole, and she's partly right, because for the most part, there's nothing to be done about the variants. I do think you should know what's out there. Even though I've been highly critical of the narrative around variants, I do think you should know what's out there. But every time a new one's identified, as you see, it makes headlines. And I think that's not really useful. Right, Amy?
Yeah, I'm not clear what the goal is. So is the goal of the test to know if you're infected and if you're another case and should quarantine? Or is the goal to know, the genetic composition of the infection? They're two separate issues, right? And knowing the genetic composition of the infection really is not changing anything. It's not changing how you manage the disease. It's not changing your recovery time. It's not changing anything. So if you want to look at it from a basic science point of view about how a virus that's novel adapts to a new host, then yeah, you should sequence. If you just want to know about your patients, then it doesn't matter.
I agree with you. I think the understanding of viral evolution is really very interesting from yours and my viewpoint, right, as virologists.
Right, but you have to decide what the goal is, right?
Yeah, sure.
You have to decide what knowledge you want, and let's get real here. I'm not sure that in the middle. I mean, I'm not sure that in the middle of the pandemic, the goal is to define the mechanism of virus evolution.
Right.
Although, one could argue that doing that in a tissue culture plate is artificial, right? So this is probably the only time you can really do that in a host, right?
Yeah.
So I think it depends. All right.
Thank you, Kat.
Early tomorrow.
Thank you, Amy. Thank you, Amy.
Tomorrow. Okay.
I'll see you. Bye-bye.
Yeah. Bye.
Oops, I'm getting all screwy here. There we go. I'm meeting Amy tomorrow to look at more spaces for our studio. Here's this story. The space I want, they won't sign the lease. And we want to light a fire under them, so we're going to go look at some other space. Not that I want them, but so I have to meet Amy at the subway at 10 a.m. John, thank you for your super chat. Am I right to be curious? I'm heterozygous CCR5 delta 32. That's the mutation that makes you resistant to HIV. B plus blood. I don't know if I have B27 or 58 alleles. Those are the HLA alleles that make you, that are associated with, elite controllers of HIV that don't get sick. My son B plus also. I were the only ones not infected in the 6-person household. Curious correlation. Yes, that's what you'd have to say at this point, because we don't know anything. You may have other genome changes that are causing you to be resistant. But these are obvious ones that can be looked at, and I don't know of any studies that have correlated these with resistance. Thank you, Joe, for your super chat. Peanut butter and banana on toast. Thank you, Kyle, for your super chat. Are you going to take responsibility if one develops serious side effects after vaccination? Me? Why would I take responsibility? Those vaccines are being given by, they're produced with help from the U.S. government, with companies and so forth. But he's telling people not to be vaccinated, but he has no data to say why they shouldn't be, and they're saving a lot of lives. Okay. Fauci said herd immunity is between 70 and 85%. I would say it's closer to 70. He's thinking that the variants have more transmissible, but I don't agree with that, so that's why I'm sticking with 70. Would you pause travel from India as other nations have done? Burma had 18 students from India test positive. Can travelers risk your herd immunity? No, they won't risk if you've achieved herd immunity. So let's say in Israel, where nearly everyone certain population has been mostly immunized. There's some people who haven't been, of course. You have herd immunity. Introducing infected people will not compromise that. No. Would I pause travel from India? It depends. If you have no one vaccinated in your country, it would probably be a good idea. But in countries with high levels of vaccination, I'm not sure it's necessary to do that. I think India has other issues that they have to deal with at the moment, right? UK has a fall booster plan, is ordering a vaccine. That's great. Washington State has announced they require vaccines, but yes, they'll require them, as Colombia is, but how will they verify it? That's what I'd like to know. Did you see a press study that indicates SARS-CoV-2 spike can alter DNA of lung cells, leaving it more prone to inflammation? No, John, I didn't see that. I don't know how a spike can alter the DNA of lung cells. Are you talking about the mRNA, but then it wouldn't be going there? Are you talking about an infection? Haven't seen it. Many people feel that vitamin D is useful, and I don't think there are going to be any random controlled trials of it, and there's no harm in taking it. So I think you should all be taking it at the right dose every day, and if it helps you, it will. I don't know if you need to do that. We have plenty of virus circulating already, so I'm not sure that that's necessary. No. What about adenovirus? Is it increasing? I don't know. You mean adenovirus respiratory infections? I haven't seen them going up. No, there's a website. BioFire has a website where you can track respiratory infections. I don't want to go look at it now, but I haven't seen it go up on that. How do I feel about loosening of restrictions on gatherings to encourage getting vaccinated? Do you think that they're to encourage getting vaccinated? Oh, you mean because if you're vaccinated, you can gather? I don't have a problem with that. So I don't have a problem with gatherings of people who are vaccinated. I don't have a problem with not wearing a mask outdoors, although I think everyone's going to take their mask off, even if they're vaccinated or not. And as a consequence, we may have more spikes. Who knows? But I do think we need to return to normal, and it's just a small step in that direction. I think if you're not vaccinated, you should wear a mask. So Daniel Griffin told a story on last week's podcast of a 100-year-old woman whose grandson came to visit her. He didn't wear a mask. He stayed for a half hour, and the next week she's in the hospital on high oxygen flow. Why would you do something like that? I heard tonight on a podcast that an attenuated vaccine administered intranasally might produce a broader, not more robust, I don't like robust, immune response and prevent transmission better. It might. So, mucosal antibodies are great for blocking infection, and they would do a great job at blocking transmission. However, the antibodies in your blood can cross to the mucosal surface and prevent infection, and they can work as well. So, I think an attenuated intranasal vaccine makes a lot of sense to me. I like flu mist because of that. It's the natural route of infection. We'll just have to see. I've always thought flu mist would be the best one to take if you could get it, but they don't make very much of it. So we'll see how these turn out. Will VSafe CDC data track whether those with no side effects have more breakthrough events, or does it track long-term symptoms? Oh, it believes it's just looking at symptoms, but they do ask you if you have had symptoms that are consistent with COVID, so they could follow up on that, I presume, right? Hello, Taiwan. What can we do to get back to 3 million vaccines per day? It's going to take a lot of local advocacy. I think a lot of people, depending on where you are, think it's over and they don't need to be vaccinated. So it's a problem. Osterholm said B117 is much more infectious, but does not know what that means. Also said does not know what herd immunity means. So both these statements I don't agree with. It's not more infectious, it's more fit. It displaces previous viruses in the population. Whether the increased fitness is a consequence of transmission or something else has not been shown. So I don't think it's fair to say that. And, of course, herd immunity applies to this. It's crazy to think it doesn't. And in the UK, it's been decided that, or it's been suggested, I should say, that the 117 variant had no effect on the outcome of the outbreak there. If the previous virus, the ancestral virus had been there, it would have been the same outcome. So I don't know why he says this. The UK government announced that the Pfizer booster will be available for the autumn-winter for the vulnerable who have had their jabs by January. That's 3 doses within a year. Does that mean we'll need yearly boosters? No, I don't think so. I think it's just to make sure everyone's immunized. And then the question of boosters we'll have to make at a later date when we study the variants and see how they respond to antibody. Unfortunately, the real key is the T cell, but that's what we do for influenza anyway. Eileen, thank you for your super chat. Here's to leasing and designing a terrific studio. Yeah, I can't wait to make a science studio. It's going to be called the incubator, of course. I thought a virus cannot infect a red blood cell. No, viruses do not infect human red blood cells, no. On the latest TWIV, am I correct in thinking it seems that the reason for the ratcheting of disease is caused by the virus mutating in a sort of antibody battle inside us? I wouldn't say ratcheting of disease. What I would say is virus reproduction. So the virus goes to a high level, and then the antibodies kick in, they reduce it, and then there's some variants in that virus population that are resistant to the antibodies, so the virus titer rises again. And so there was no information about actually disease in that paper. It's just about reproduction and tamping of reproduction by the antibody and resurgence of variants. Very cool paper, by the way. Small fiber neuropathy contraindicated for vax. Not that I've heard. No, not at all. There's lots of vaccine misinformation online. Yeah, it's a big business. It's hard for us to counter it. We just do our best. Recently, I've seen news about 2 women being paralyzed after receiving Pfizer. I would be highly suspicious of that. I have not heard of that in my channels. There were some reports in Israel of myocarditis as well. Not clear to me that these are actually vaccine associated. We'll find out because they get investigated and we find out what's going on, Damon. I'm not believing this spray that Israel says they have developed to kill 99.9% of the virus. Have you seen anything? Yes, we talked about it briefly on last Friday's TWIV. It's a nitric oxide donor, so this would inactivate the virus. So the idea would be you would spray it in the nose and would inactivate a lot of virus, but it doesn't remain around forever, and the virus keeps reproducing. So I'm not sure what the long-term effect would be of that, but it's in clinical trials, so we'll see if it's useful. Why would they produce vaccine boosters if the variants don't make any difference? Just to be sure. Okay, the variants can be handled in terms of disease and hospitalization by the vaccines. But the mRNA vaccine is easy enough to change. They want to have it ready in case, say, one variant takes over the world and infects everyone. But it's not, of course, doing that. But just think of it. Every locale has its own little collection of variants. So how are you going to deal with that? Sometimes there's one variant that's dominant, but more likely, if you go to covariants.org, you'll see that most places have tons of different ones and they're small fractions. So I think it's just hedging their bets. Third shot for durability, not effectiveness. Well, we'll see if that's actually what you need for durability. I'm not convinced. Elaine, thank you for your super chat. Very great, very nice super chat. Can't wait to hear you pronounce my name, Elaine. Elaine, is that right, Elaine? Sorry if I messed it up. A lot of people mess my name up too, but it's probably wrong. Tom, thank you for your super chat. We live in a world of viruses. VR outreach has inspired a lot of us. Thanks again. Thank you. I'd like to inspire people. That's great. James here is an Amy admirer in Topeka, which we saw before. I mentioned before, but we didn't see it. So they're just coming up so I can click on them. When do you get sneak peeks? Well, so right now I have some photos of the room that I like, the space I like. It hasn't been renovated yet. It has to be. We need to take some walls down, and we need to change the rug because the rug is a mess. But I can show you those at some point, maybe the next stream next week, and then as we get, I'm going to take videos as we repair it and so forth and build it out for sure. When you donate blood, they test for COVID antibodies. Spike, yes. If you test positive, they do a second test that looks for other COVID antibodies. They probably look for nucleoprotein to see if you've been infected. A way to find out antibody status. Yes, that's responding to the lady earlier. You could use a antibody test that looks for spike and protein antibodies. That's for sure. Yeah. What's the reason behind the surge of COVID in India? This is very interesting. I was talking with Amy today. I said, you remember in the last few weeks, people are saying, why are there so few infections in India? And the answer is they weren't testing very much. There was a lot of virus there. And now it's taken off. Why? Because a lot of people living really close together, a lot of poverty, very poor medical care. That's why it's exploding. It's not any particular variant. If you go to covariance.org and you look in India, first of all, they do hardly any sequencing. So it's hard to know what variants are making up any fraction of the isolates. But this is all driven by the population being the way it is. It's unfortunate. Very poor health care and so forth. I got my second shot. I don't know what you're talking about. I got 2 shots. Amy got 2 shots. If you're getting J&J, it's only a 1 shot. So 1 and done, right? You don't need 2. I think, John Snyder, you're talking about adenovirus. Yeah, some adenos bind platelets. That's right. And the role of that in the clotting is not clear. I've been meaning to look into that, but I've been grading exams and I just finished them. Are errors in viral replication considered mutations? Well, if you mean as the polymerase copies the genome, it makes errors. Yes, those are mutations. You get base changes in the genome. They happen at every copying of a nucleic acid, whether it's DNA or RNA. And they allow evolution to occur, right? The fodder for evolution is mutation and high numbers of viruses produced. Selection, you have to have a selection pressure like antibody or something else. And the quasi-species, which means the diverse virus populations that exist out there. The USA is giving away AstraZeneca because it's never going to be approved. I don't know if that's the case. That's what I've heard also. But I don't have any insight into why we're giving it away. But, it's got the clotting issues are very low, so hopefully it'll be of use. I have an issue with that. But then again, we're resuming the J&J vaccine, which has clotting issues as well, right? So there you go. Hey, this is cool. How do 4 bases AGCT form billion of combinations? Well, they're long genes, right? With, say, the spike is several thousand ACGU. And there are triplets that form the genetic code, right? Triplets make one amino acid. There are 20 amino acids and 21 amino acids, and then you can have different combinations of amino acids that make a protein. So that's how it works. Well, it's an interesting point because when DNA was first discovered, they said, oh, they're just 4 bases. How could it be the genetic code? It's not complicated enough. They actually thought proteins were the genetic code because they're chemically more complicated. Turned out not to be the case. About my earlier question, active versus passive, but don't think it should be called vaccination if it doesn't induce a T-cell response. Well, vaccination is defined as giving an altered form of the pathogen to people. That's all it is. It doesn't the actual outcome, whether it's B cells and T cells or just B cells, that's not part of the definition. It's an old definition, made by Pasteur. So they didn't even know about B and T cells at the time. If one is fully vaccinated, can you carry the virus and spread it? Probably not. I think what happens is when you're vaccinated, then you're infected, you have a memory response which quickly limits virus reproduction in your nasopharynx, in your upper tract, and it's much less likely to transmit to others. And I think this goes for people who are close to being vaccinated, shortly after being vaccinated, and a year out as well. How long that lasts, I don't know. That's a good question. Number one problem in Brazil and India are their presidents. I'll take the word from you because I try not to get involved in politics because I used to get yelled at ferociously. I said I deal in science only, and it's true. I shouldn't deal in politics, so I don't. Thank you, Ronald, for your super chat. Any chance of putting this on one of your podcast channels? I don't know. I've thought about that, but you could just play the YouTube on your phone and listen to it, right? One other person has asked for that. I might try it. Just to see if anybody subscribes to it. Okay, I might do that. My sister is immune suppressed, or sibling. I'm not sure what SIL is, but anyway, he has had fully vaccinated, no antibodies. Well, if you're immune suppressed, then one form of immune suppression is that you don't make antibodies. Yes. So in that case, if you got infected, so you have to be very vigilant of symptoms. And if you get symptoms, you get tested and you get monoclonal therapy to keep you healthy. Can the usual COVID antibody test show whether someone is vaccinated? So there are 2 antibody tests. One detects just spike, and that will, that doesn't distinguish between the two, right? Because the spike plus N tells you if you're infected, but the spike plus N, if it has separate lines, and it should have a separate line on the lateral flow if it's a lateral flow. If you have spike but not N, that means you've been vaccinated. If you have spike and N, that means you've been infected. Now, Rich has just been away. He'll be back Friday. He got tired of us for a while. No, I don't think he sounds like me. My voice is higher. Can you post questions from women-sounding names? I do. I just pick them as I go down the list. I just skip the ones where people are chatting with each other. But, Pat, you had an opportunity. You didn't ask a question. Okay, you put Q&A on Spotify and Apple Podcasts. Okay, I'll do it. Okay. Thoughts on CDC mask regulations? Yeah, I think it gives people an excuse not to wear a mask. My colleague Ian Lipkin doesn't like it. I think most people will just not wear a mask whether they're vaccinated or not. And so I think there will be more local infections as a consequence. I think it was a balance. They decided, let's get a little bit of normalcy here. And they, I totally understand where they're coming from, but I would have liked to wait another month or so. But outside, it makes sense because there's minimal transmission outside, right? Wendy, here's a lady. It drives me crazy now whenever I hear all the media outlets and experts state as a given that the variants are responsible for the increased cases. Yes, it drives me crazy too, Wendy. They all assume that the variants are. But if you look at the fraction, if you go to covariance.org, you can go. Unfortunately, you can't do it by state, but you can see what fraction of infections are caused by what variant, and you see that it's quite broken up. It's never just one, or it's rarely just one. Mark Kulas is whose Housatonic Live has some interesting history regarding you. Okay, I'll check it out. I don't even know what it is. Is it a podcast? Someone needs to share with them the paper stating that the variants shared no role. Yeah. A lot of them are in preprint, so we're waiting for them to get accepted. Then we'll talk about them on Twiv. I love the idea of corporations requiring masks. Takes the politics. It can be left to the corporations. I think probably that's reasonable. What will Pfizer charge for that antiviral? You know, the Hep C antiviral was $12,000 a pill. Yep. Wow, we're just getting to saying hello to Amy. Wow. If you want to know about the efficacy of the Janssen, that's the adenovirus single dose that's been paused. You know, the efficacy in the phase 3, it was good, and it was done in several countries, and you know, I don't remember the numbers right now. It was good in the U.S. It was good in South Africa, where the variant is a high proportion of the cases. It prevented 100% hospitalization and death, despite antibodies induced by the vaccine not neutralizing that virus as well. It was tenfold down in neutralizing. So it just goes to show that if you just take variants and you do neutralization assays, it's not going to tell you the whole picture. You want to know if vaccination prevents disease and death. And for that one, it did. How expensive is your monthly lease? So right now, New York has got a lot of vacancies, right? And this is in the garment district where a lot of buildings are empty. I think it's about $3,000 a month for a lot of space. I don't remember the total square footage, but we think we're getting a good deal. So, and I'm sharing it with Daniel Griffin, his Parasites Without Borders nonprofit, and Microbe TV. So we'll split the costs between us. And I hope to be there a lot and make a lot of content and get more YouTube followers and podcast subscribers, make different kinds of content besides podcasts, short videos explaining things. You know, I'd love to make one a week. And I think we could, and I just want people to support us by donations. I don't want to do ads. I don't do ads on YouTube, so I'm hoping that works. We'll see. I want to try it. If I didn't try it, I would be disappointed in myself, right? Columbia, there are 2 immunization requirements that all students must meet: MMR and meningitis. Yeah, so they require them. I'm sure they'll require a COVID vaccine for sure. I don't have a problem with that. I was talking today. When I used to travel, I traveled in the 60s with my family to Europe. My father was born in Italy. And the first time we went, we had to have a smallpox vaccine certification in the passport, right? And we didn't think twice about it. Nobody thought twice about it. I recall you saying greater initial dose does not affect severity. Well, all I'm saying is apocalypse is that we don't know. And there's some people who concluded that it did without having any data for it. That's all. That's always my objective. I want to see the data, all right? If you're making a claim, show me the data. And in most of the COVID era, there's very little data to support the conclusion. So, you know, when we infect mice with our virus, we can give increasing amounts of virus. you get the same disease. It just happens faster. So, you're never going to be able to do that experiment in people, but I don't see any evidence for it. That's all I'm saying. I'm not saying it's impossible, but I don't see the data. Just like I didn't see the data that the variants were more transmissible or more virulent, which the latter, by the way, has been disproven. Another question related to vaccine. When I felt immediate arm pain, does that mean my body was building an immune response? Well, immediate arm pain is them sticking the needle in your tissue, right? Yeah, it hurts. It's a deep needle, right? It's an inch at least. It goes deep into your muscle. It hurts. And that's immediate. No, the immune response takes probably 8 to 12 hours. And then if you get soreness, like I got my first shot in the evening, and at like 3 a.m. I rolled over onto my shoulder and it was sore, probably the initial inflammation happening. And so you should find delayed symptoms. That's what I'm saying. And after the second dose, if you got a second dose, you should maybe have a fever. But if you don't have any of those, it doesn't mean it's not working. Yeah, we talked about Sputnik. We talked about the fact that they're probably replication competent, which is really too bad. That they could make that kind of mistake, but hopefully we get more information on that, right? So the vaccines in India, someone has put the numbers up later. Here we go. Andrew says 8.79% one dose, 1.71% two doses. Christian Drosten thinks we need a third shot because of waning IgAs. No. IgAs will wane after 10 shots. It's all about memory. If the IgA went to 0, then I would say maybe. But if it's at a low dose, that means there are memory cells that are around. That's all you need. I don't agree. India's going to stop exporting vaccines. Yeah, they need to keep it for themselves. I totally agree. Why haven't we started a wartime jobs program to develop our own PPE and pharmaceutical factories? Well, this should have been done a year ago, right? And if it's not going to, the wartime efforts are good for the war. And then after the war, you stop. So it's kind of late to be starting that, right? Does excess body fat blunt immune response? So there is some evidence that obesity is associated with, obesity is associated with itself with inflammation, but it can be immunosuppressive as well. But it's not to say that if you're overweight, you're not going to have an immune response. It may be that if you're naturally infected, you have a poorer outcome. But I don't think it blunts vaccine responses. Do the COVID antibody tests detect antibodies? Well, the antibody test would be looking for spike. So you could have a spike N protein antibody test, and if you're vaccinated, it'll just react with spike. So no, the adenovector doesn't matter in that case because you're making spike protein and the adenovector will not interfere. Here in Switzerland, there's discussion that those infected need only one dose. So the recommendation here is that of your immune response after the infection. As we've discussed in this thread, the virus can antagonize immune responses, and so it could compromise your immune response. So get vaccinated. Both shots if it's a 2-shot deal. I don't know. Somebody just said the stream was interrupted. I paid Verizon to get gigabit Fios. So I have to get better internet in my studio, right? Yes, the NHA is providing rapid antigen tests to all UK residents. Yes, that's exactly what Michael Minna was advocating last year. It never happened. So I'm really glad the UK is doing it. And I think it's it should make a big difference, although it's kind of late-ish, right? I'd like to have it last year. Boy, the stream is so lagged. How do the Pfizer and Moderna mRNAs make their way to ribosomes? Well, if somehow the RNA has to get out of the lipid nanoparticle into the cytoplasm, and then the ribosomes will engage them. That they just randomly, RNA gets randomly engaged by ribosomes. Now, the RNA, I don't think it needs to move around on microtubules, because as soon as it enters from the plasma membrane, it can be translated. Merck released an encouraging statement. 5 generic drug manufacturing plants in India will make molnupiravir. That's good. You know, as long as everybody in India who needs it gets it, right? I'm not certain that that's going to be the case, but hopefully it will. My son asked me today, someone who had COVID and vaccinated better protected. As well, we kind of hit this at the top. It's hard to know. It varies for each virus, more or less. You know, natural infection with many viruses gives you lifelong protection, like measles and poliovirus. It's not clear for SARS-CoV-2 if that's the case or not. We need to wait a few years to answer that. Israel doesn't plan on vaccinating kids under 12 because by then herd immunity will be achieved. So that's the thing. Herd immunity assumes a random distribution of immune people in the population. Kids go to school and there are 20, 30 kids in a classroom. They're all non-immune. Herd immunity is out the window, right? There's one teacher who's vaccinated, but if one kid brings in virus, he or she will infect others. So I think you have to randomly, if it's 70% of the population that you need to be immune, you have to get it randomly across all age groups. You can't say kids are not going to be vaccinated. It doesn't work. That's my opinion. I could be wrong. In a swimming pool, if someone is infected, swims 6 feet away blowing breaths, is that safe enough for me? Are you vaccinated? I would not swim unless I were vaccinated. My wife has been swimming 3 times a week since she's been vaccinated. You know, the Y puts more than 6 feet apart. They only let 3 people in the pool at a time. And I think that works. I received my second Moderna. I was put on steroids 3 weeks ago and be staying on them for a while. Will this reduce my immune response? It depends how close to the second shot you got them. Immediately, it could reduce your response for sure. You take on saunas and steam rooms. Vaccinated people could use them, I think, right? Small gatherings indoors. I think it's fine. What new concerns have arisen for the potential weaponizing? Weaponizing of viruses doesn't really work very well. People tried it for many years, mainly in the Soviet Union, and for the most part it fails. They're not good weapons. There are other better weapons that people can use. Adaptive is 7. Well, it starts to kick in around 7 days. Yeah, but, you know, it has to fully mature. And for the vaccines, we don't see protection kicking in until about 11 days. 2 days, a memory response. 2 to 3 days, yes, the memory cells will start kicking in. So we talked about the mask guidelines. I don't particularly agree with it, but I as I said, I understand why. I understand why we're doing it. You're currently competing live with the man who brought the country together to... it's fine. You guys are here. 471 of you. I mean, millions of people are watching him. It's fine. I don't have a problem with that. I will never get millions of people watching me. Never, ever, ever. I am resigned to it. I'm thrilled that I have 472 of you here tonight, though. I never in my life thought, outside of a classroom, I'd have more than... So the most people I've lectured to in my classes, 170 students. I've given lectures to 1,000 people. But, routinely every week, this many people, it's great. I'm from Hungary. I took AstraZeneca. What should I do next? Get the second shot. You're good. Take the second shot. Yes, please hit the like button. I know a lot of you have, but it's, hitting like just kind of signals other people that something cool is going on here. Yes, you don't want to be an unhealthy 22-year-old. Young people can get sick. Young people can get sick. I don't know if we've shown these super chats, but thank you, Joe, very much. And Ditching the Grind, thank you very much. I wish someone would make a vaccine against stupid. Well, that's not happening. So we have to propagate anti-stupid, right? If you've taken AZ and now they tell me I have to wait 12 to 16 weeks, can I get a different shot? Well, it depends where you are. You could get something else. They're all, I think, compatible. But it just depends where you are and whether they'll let you do it. Will mink and cats act as disease reservoirs? Yes, and other animals like rodents. We will never be able to eradicate this virus. We're stuck with it, unfortunately. Yeah, there will always be infected people or some other animals on the planet. Yeah. So thank you. Go Columbia, huh? Thank you very much. Someone told me 34 docs have gotten COVID despite having been vaxxed. Yeah, but we don't know what vaccine and if they got the full dose and what kind of disease. Did they get nothing? Very mild disease? Then it's fine. We don't care, right? Yeah, there was a male patient with a clotting disorder, one. Yes, I agree. Should you worry that you had no side effects? No, it's all good. You're likely fine. Binax now. The glaring amount of cost cutting. We have an email on which I just queued up today for Twiv of someone who liked it. She thought the kit was nicely done. So if anyone has contrary feelings, send the Twiv at microbe.tv. Yeah, so this myocarditis in Israel, I don't know what to make of that because I've not heard of it anywhere else, right? And other places have put many more millions of Pfizer into people like here. So I'm a little suspicious until we see the analysis, right? All right, we got 9:27, 3 minutes. So let's see if we have some more super chats that we should acknowledge. Here's Eileen's. Thank you so much. Terrific studio. And then we'll go back and get some more questions. Thank you, Elaine. I don't know if it's Elaine, but you could type it out phonetically. Thank you, Tom. And there's so many good questions. Oh, thank you, Bob. Rather watch you, sir. It's very kind of you. I'm very, very humbled by that. I always thought that people want to listen to kind of sciencey stuff, and people do. People do want to do that anymore. Okay, here we go. We're at the ends. Look at that. Potential of mRNA vaccines to treat cancer. I think they're going to be tested. Yes, I think Moderna has some mRNA vaccines for cancer testing. Michael Minna's $10 tests on sale at Walmart's. Really? Are they labeled Michael Minna or they're just rapid antigen tests? And what's the name of it? That's funny. Any news on Novavax? No, we talked about that earlier. We have heard nothing. Kind of surprising. Sandy, thank you for your super sticker. Really appreciate it. You think I'm a lot of fun? I'm okay. I enjoy people. I enjoy doing this. I even enjoy people in person. Before the pandemic, I used to travel a lot and do podcasts all over the world. If you go back in the catalog, you'll find some of them. All right. So I think that ought to do it for tonight. Thank you, Wendy, for your super chat. You've inspired me to email back my old friend in New Zealand. Cool. Here it is. He's going to Canada next week and we'll get vaccinated. Frank, thank you for moderating. And thank you all for coming. I really appreciate it. We'll be back next week. Amy and I will return on the Wednesday next week, 8 p.m. Eastern Time. We have some interesting things coming up. I've liked this live stream a lot. So in the fall, I am going to teach a virology course live streamed, my introductory course, and I'm going to see how it works out. So we'll do maybe 1 or 2 a week, and people will be able to ask questions. And then if that works out, then I'll teach more virology, like advanced virology. I'll teach emerging infections. I think it could be cool, a new way of teaching by live streaming. Let's see how that works. So good night, folks. Thanks for coming. Have a great evening. Stay safe, and we'll see you next time.